The Liverpool Interdisciplinary Neuroscience Centre, or LINC, is a centre of excellence in brain and mind research here at the University of Liverpool, which spans the breadth and depth of neuroscience from molecules to patient outcomes.
Hello, I'm Gavin Freeborn and this is Original Ideas, a podcast from the University of Liverpool. In every episode we explore academic research, looking at the impact it has on our future and the changes it can make to wider society. We discuss the latest breakthroughs and meet the people who are using academic research to drive change. In this episode, we're exploring a brilliant topic, neuroscience and pain.
Neurological conditions and disorders are the leading cause of disability globally. They're also a second leading cause of death globally. The formation of an interdisciplinary neuroscience centre like LINC is an incredibly important aspect.
As ever, we have a fantastic set of guests. Joining me in the studio is Professor Benedict Michael, Director of the Liverpool Interdisciplinary Neuroscience Centre, and Professor Michelle Briggs, Clinical Professor of Nursing and part of the Pain Research Institute. Together, Ben and Michelle lead pioneering work uniting laboratory discoveries and clinical practice, which has led to the University of Liverpool's expertise being recognised on a global stage. We'll find out more about their work, the launch of a world-leading hub here in Liverpool, and research developments in neuroscience and pain that could help reshape how we think about prevention and treatment for millions worldwide. Let's find out more. So, Michelle, Ben, welcome to Original Ideas. Before we begin, could you briefly tell us about your background and what led you into your area of research? Michelle.
So I am a adult nurse. So there's 4 branches of nursing. So I'm in the adult branch of nursing. What led me into this area of research is that I started my career in Nottingham. I did a degree in chemistry, and all that taught me was I wasn't cut out to be a chemist. But I was able to do a postgraduate nursing qualification and then went on to specialise in trauma intensive care and neurotrauma. And during that time, I got involved in a lot of research and research trials that were happening at the time, and saw a job being advertised for a research post, which was in Leeds at the time when they were hoping to implement pain research and acute pain services. In the 90s, that wasn't a thing. And so I started to move into implementing research findings and leading an acute pain service. And that generated lots of pain questions for me as a nurse around the important place that nurses play in helping people understand their pain and live well with their pain.
And then your journey to Liverpool?
So my journey to Liverpool, I've been in Liverpool for a couple of years now. Before that, I was in Manchester, and I was attracted to Liverpool precisely because of the neuroscience and pain research. The Liverpool Pain Relief Foundation is internationally recognised for the work that they support and the charity that they are helping people who are coping with pain in their daily lives. And then the Liverpool Pain Research Institute, again, is internationally recognised, has over 40 or 50 clinical academics. And I'm a clinical academic. I have a joint post, which is I'm one of only, I think, 2 or 3% of professors of nursing that have joint NHS university academic appointments. And nationally, we're campaigning for more clinical academics because of the really important part that they play in joining up what we see clinically for patients and what we see academically in terms of the questions that need answering.
Brilliant. Thank you very much. And yourself, Ben?
So I'm Ben, I'm a Professor of Neuroscience, but I'm a consultant neurologist in the NHS, a bit like Michelle, across wearing 2 hats. What brought me into research really was that as a junior doctor, I'd see these people come into hospital with acute confusion, sudden onset new confusion. And if they were elderly, it was always attributed to being old or maybe a urinary tract infection that tipped them over the edge. And if they were young, it was attributed to psychiatric problems or maybe drug or alcohol abuse. And whilst that was often the case, actually there was this group of patients within there with brain infection and brain inflammation, the thing that's medically called encephalitis. And they were going unrecognised. Doctors weren't thinking about the condition, they weren't doing the right tests, and therefore these people weren't getting a diagnosis or treated well. And without that treatment, many of them have very, very poor outcomes, high rates of death and disability. So what really got me excited about research was the opportunity to start to change that.
Brilliant. Thank you very much. So, Ben, if we can start with you, the new Liverpool Interdisciplinary Neuroscience Centre has been described as a world-leading hub uniting brain and mind research. What does that mean, and what is it that we're hoping to achieve with the centre?
Yeah, thank you. So the Liverpool Interdisciplinary Neuroscience Centre is quite unique as a thing that we have here in Liverpool. In most universities, neurology is separate from neurosurgery, is separate from psychology, and we want nothing to do with psychiatry, and the basic scientists are different from the clinical scientists. And that's a problem. I mean, if you take something the audience would have heard of, like a brain tumour, for example, a lot of the death and disability comes from the seizures related to that. And a lot of the seizures are due to the inflammation around the tumour. And a lot of the drugs we use to treat the seizures, the inflammation and the tumour, actually result in significant thinking and cognitive and mental health problems. So it's kind of madness that we've ever tried to solve these problems with silos of epilepsy and pharmacology and neurology over here and inflammation another thing and mental health another. So what LINC does is really bring together over 200 clinicians and scientists working across the Liverpool estate to fundamentally address the complexity of this brain-mind interaction, which underpins almost every single neurological disorder.
Excellent. I think that's a very important thing to do, and I guess it's a little bit like a larger academic and clinician version of the multidisciplinary team meetings that people have in hospitals, where they bring the staff all together around one patient to connect up their minds and try to work out and problem solve the issues. So Michelle, as part of your work in Liverpool's Pain Research Institute, which brings together researchers, nurses, doctors, physiotherapists, psychologists, and others to study pain, can you share an example where collaboration between clinicians, scientists, and maybe even patients has led to a new insight or treatment approach?
So the example that comes to mind is the work that I'm doing with Dr. Sue Hartup, one of my postdocs, around post-mastectomy pain. And so when women and men who are diagnosed with breast cancer face surgery, Sue is a nurse consultant working clinically with these patients, and she was looking at the cancer survivorship, so people who'd survived cancer, looking at their quality of life and asking them about their experiences. And she found that about 50 to 60% were having pain as a result of the surgery that they'd had in her particular audit of patients, and that concerned her, and she went to speak to a few women. What particularly one woman's quote captured her interest and she wanted to know more about was that the person had said, if I had known that the chronic pain experience is debilitating, they're not able to do sports anymore, not able to drive because of a seatbelt, not able to work because of the medications that they were taking to try and solve the pain. And the quote that she came to me was, had I known that this was the life that I would lead, I'd have said no to the cancer surgery. So Sue came to me as a clinician and said, I think I need to write this up. And I said, I think you need to do a PhD. I think that this is a problem that we can solve. So she went for funding for a PhD. The NIHR funded her PhD. One of the challenges with mastectomy or breast surgery is its day case. So being able to have your pain well managed during the surgery and immediately post-surgery, which we know from lots of studies makes a big difference to how many people go on to develop persistent post-surgical pain. If that's happening as day case, the opportunity for nurses to intervene and make that experience better is smaller. So what we've developed is an online digital platform where people are able to diary their pain concerns, talk about their pain, fill in questionnaires, but those questionnaires, there's an AI algorithm behind it so that all of that information they get pre-surgery is handed to them and say, oh, if you're experiencing a problem with your drain, please read this, maybe you need to do this. But also it automatically emails their clinicians so they don't have to sit at home worrying, is this something I should ring somebody about? Should I ring my GP? Is this normal? So all of that happens within the web intervention. And we're now currently have funding to see if that can, we've done that successfully in Leeds. We're now rolling that out to see if we can do that successfully into Liverpool, Manchester and Southampton. And so that intervention hopefully will revolutionise the experience of people who have surgery and then go home and suddenly won't feel so alone in navigating that immediate post-operative time.
Brilliant. Sounds like a really important piece of research and service that you've created, and I can only imagine what someone who's gone through such a traumatic event as mastectomy surgery must feel like. So it's great that you're doing that work. So there are great pieces of research coming out of Liverpool all the time, including your recent paper on post-hospitalisation COVID-19 cognitive deficits. From your perspectives, how are discoveries like this reshaping scientific understanding and patient care for chronic pain conditions? Ben.
Thanks. So one of the kind of most pervasive and disabling components of chronic pain conditions is fatigue and brain fog, difficulty with the clarity of your thinking. And one of the challenges in studying this is that in many chronic pain syndromes, like fibromyalgia, for example, it's not always easy to pinpoint the exact moment that there was an insult that led to the condition. COVID, in a way, represented a sort of natural experiment, if you will, where a whole population was exposed to a singular insult at roughly the same time. So it was an opportunity for us to study how this brain fog and thinking difficulties could manifest themselves. And we were lucky to secure a substantive £2.3 million grant from the MRC to lead the national study of this. There was lots of research that came out of that, but one of the bigger papers, and the one that was published in Nature Medicine earlier this year, was following these patients up. How do they recover after they've been discharged from hospital? And what we found was that at about 1 to 1.5 years after hospitalisation, these patients still had cognitive problems. And it wasn't just that they reported them. When we gave them a cognitive test and compared their scores to 10 education and age-matched controls, they actually scored lower than would be expected. And there could be an argument that maybe these people have been sick, they might be depressed and anxious or have PTSD from the trauma of the pandemic and the hospitalisation. But actually, when we looked at their brains and did an MRI scan of their brain and compared the structure to, again, age-matched controls, there were volume reduction changes, so shrinking in areas of the brain which are similar to those seen in someone who's about 20 years older than would have been expected. And that those same changes correlated with the presence of brain injury proteins in blood. So these are bits of the nerves and brain cells that shouldn't really be detectable in the bloodstream. And these were detectable even 1 or 1.5 years after the infection had been and gone. What was really critical was that the cognitive difficulties did correlate with scores of depression and anxiety, etc. But also depression and anxiety correlated with the brain imaging changes and the brain injury protein changes. What it showed us, I think, is that this Cartesian dualism, this separation of what's brain and what's mind, is a false dichotomy. And actually there's a complex interaction between both the biological and neurological components and the psychological or mental health components.
Excellent. Thank you. And Michelle, do you have anything to add to that briefly?
I think from a nursing point of view, it's an incredibly exciting time to be part of pain research, because certainly in my clinical experience, when patients would come to me and say, oh, they think it's all in my head. And, and I can't cope with that. I think that they think it's all in my head. And I'd say, well, yes, of course it is, because that's where your brain is. And the brain doesn't decide which bit is psychological or biological, or it's just coping with information. And it really helps us now when we're able to see, and the imaging and the mechanisms that people have to make visible those things. It's an incredibly exciting time.
Definitely. And in terms of the patient care for those chronic pain conditions, can you give a few short examples of some of the interventions in terms of the social interventions?
So one of the challenges that we have is very often when somebody goes to a GP surgery and they have pain, it's a really limited time that you have to be able to provide support that you need across the tablets might work, the physiotherapy that you might need, or being active. And some of the challenges that we have are staying socially connected. And that's easier said than done for some people. And there are really good examples. So I would point people towards Flipping Pain, which is a patient-focused web page where you can learn about how you connect into doing connecting up with nature, connecting up with. So another good example would be Rethinking Pain, which is based in Bradford, and patients there are able to have consultations with a health trainer where they say, well, before the pain took over your life, what were the things you enjoyed doing? And if somebody said, oh, well, I enjoyed walking, but I don't want to walk on my own and I'm scared of the pain might come back. And so there's a walking group with lots of other people in the same position. Because that's the thing, is you need to be able to think of a connection where the people in this group understand the space that I'm in and that I feel like I belong here. And belonging means that actually you're going to be missed if you don't turn up. People are going to reach out and say, it's okay to be you in this space.
Definitely. And that type of social prescribing helps people feel, that type of social prescribing helps people feel like they're not dismissed by society.
Yes. So that actually but that's a challenge to do for GPs. And there's work that I'm doing with our primary care colleagues, trying to understand how you connect up and make good decisions. So how GPs might know what's available in their area, how people with chronic pain can connect up with the things that will help them live active and well lives and accept the pain that they've got and try and work around it and through it rather than against it.
Definitely. Thank you. So another piece of news that made headlines recently was the 1.7 million award here at Liverpool to Dr. Andrew Marshall for a project to investigate how stress and early experiences affect chronic pain. What might it mean for preventing or treating pain if we better understand the role of stress and inequality? If one of you can answer that, please.
So, this is really important work. So we've known for the longest of times that adverse childhood experiences have a dramatic, many-fold increased risk of you having later life chronic pain syndromes. The mechanism for that's been completely not understood. And it's been largely thought that probably some adverse childhood events affect your brain development in some way, and that then later in life you have a physical insult and you get chronic pain syndromes. What Andy's work has shown is that actually if we look with this thing called microneurography, but effectively looking at really tiny nerves in your fingers and your toes and elsewhere in your body, we can actually see there are changes, what they call plasticity, changes that kind of prime those peripheral nerves to be on the alert for pain, sort of oversensitive to pain. So that means that when you get a stimulus that wouldn't normally be painful, actually it's perceived as pain. So not only might these people have a kind of central or brain priming from the adverse childhood experiences, those same adverse childhood experiences might prime their peripheral nerves to be ready and on the alert to have an over-responsive response to pain. And it's that combination of peripheral inputs of pain and central pain processes, which is really, this is a real shift in the way we think about this. And what this means for patients, of course, is partly to Michelle's point, a huge part of this is the patient feeling they're being understood. There's an understanding. The doctors can make sense, the nurses can make sense of why I'm having these symptoms. And that's really a huge first hurdle. And the second thing is actually that understanding the biology of this and the psychology of it could transform the way we treat these people going forward, who too often, fall between the cracks.
Definitely. And I guess that sort of fight or flight connection, which is something that's long been, understood quite well in terms of the amygdala, etc. That trauma that people receive maybe in earlier life is connected to the triggers later on in life. So looking ahead, what excites you most about the future of neuroscience and pain research at Liverpool? How are we shaping the next wave of treatments or technologies for neurological and chronic pain conditions in the UK or even around the world? If you want to start, Michelle.
For me, I think it's the recognition of the brain we're born with isn't the brain we die with. And that during our life, events that are psychologically adverse, emotionally damaging, socially excluding, and biological insults all affect the brain, and we're beginning to understand. And that's the really exciting thing about the Liverpool Interdisciplinary Neuroscience Centre, is the recognition that we all have something to contribute to that, in that the person in front of us has one brain with multiple things going on, and we're beginning to have the techniques and the skills and pulling together all of those professions to try and unravel that puzzle, to look at new drug targets, to understand and help people explain their pain and work out better ways to live with their pain. And so for me, it's an incredibly exciting time to learn from imaging, to learn from our science colleagues around what we can understand about how the brain works and how the brain can, for me personally, how we can create more opportunities to prevent chronic pain. And that's where I'm most focused on, is the prevention of that disability and that chronic pain going forward.
Brilliant, thank you. And lastly, Ben, if you'd like to answer on the same point, please.
Yeah, thanks. I mean, I couldn't agree more with Michelle. I think it's really exciting research happening here in pain and in neuroscience more broadly as well. And it's a lot of it is making the invisible visible, isn't it? And I touched on these brain injury proteins that we can find in blood. I think one of the really exciting things we're moving towards now, and really testament to the interdisciplinarity of the whole piece, is that we're now working with material scientists and with basic chemists and basic neuroscientists to develop new ways of detecting brain dysfunction and brain disease peripherally. I talked about Andy's imaging small nerves. The other really exciting thing is, many of you will have heard of the Libra patch that diabetics wear that monitors their glucose. We're now developing patches, wearable patches like this, that allow us to measure these brain injury proteins, even in skin compartments, in a painless, real-time way. And that's going to tell us when there's an insult, be it physical, be it biological, be it infection, which patients are at risk of brain disease and dysfunction, and when are those patients deteriorating. And as Michelle says, intervening early in any of these conditions is what makes the biggest difference for the long term. So that's really, really exciting.
Incredible. Thank you. Well, it's been really great to meet both of you, and thank you for making time, and we look forward to following your research.
Thanks for having us.
Thanks.
That brings us to the end of another episode of Original Ideas from the University of Liverpool, looking at the brilliant work taking place focusing on neuroscience and pain. Thanks to my guests, Professor Benedict Michael and Professor Michelle Briggs, for taking time to give us some insights into their research. It's really interesting to find out more about Liverpool's new Interdisciplinary Neuroscience Centre, the Pain Research Institute, and how they work with clinician science to benefit everyday people and alleviate suffering. We invite you to follow and rate the Original Ideas podcast and check out some of the other episodes from the series. We've looked at topics such as archaeology.
We can offer you stories of snapshots from the past that show how we perceive the past can be reshaped.
The future of AI.
We really see the AI tools working side by side with the humans who are going to be deploying them.
And even what research can tell us about dementia.
There's 14 risk factors that have been identified that might cause or lead to or are associated with developing dementia.
Head to liverpool.ac.uk/research, where you can also sign up to our monthly research newsletter with updates on events, opportunities to work with us, and much more. See you again soon.